Good evening, distinguished guest, fellow researcher, and organizer of International Conference on Medical Education 2025. In today's presentation, I will talk about innovation in medical education and research. Particularly, I will talk about a blood pressure estimation by using a deep learning model. My name is Dr. Wasimullah, Associate Professor from School of Information Engineering at Yangon University. So before going in depth about our proposed study, first we need to know why I choose blood pressure estimation by using a deep learning algorithm, because the reason is, according to WHO, World Health Organization, CVD is #1 cause of death, and blood pressure is a risk factor or a biomarker of CVD. So that's why I choose to talk about a blood pressure estimation that by continuously monitoring of blood pressure, we can reduce the risk of CVD. So before going in depth about our proposed study, first we know a little bit about CVD. That what CVD is, we know that CVD is a class of disorder affecting the heart and blood vessels, such as like heart attack, stroke, hypertension, and heart failure. According to World Health Organization, 1.28 billion adults they have a hypertension, and among 1.28 billion people, 46% of adults, they are unaware about their status, about their health status, and it's undiagnosed. So, which is a critical situation. We also will talk about a summarized definition about a blood pressure. That blood pressure is basically a force extracted by circulating blood against the wall of arteries, and we measure blood pressure in two values, which is systolic and diastolic. And also, as we all are from biomedical engineering and medical field, so we know that blood pressure have many categories, such as like hypotension, normal, hypertension, and then in hypertension we have two stages like stage 1 and stage 2. In this study we will particularly talk about hypertension. And as I mentioned that blood pressure, it's a biomarker of CVD, so that's why we need to continuously monitor our blood pressure. That will help us to early predict the CVD, cardiovascular disease, and in this way we can prevent. The symptoms of hypertension is like it's nose bleeding, headache, chest pain, blood in urine, shortness of breath, vomiting, etc., etc. So all these are the symptoms of hypertension. In our study, we predict blood pressure from a PPG, from photoplethysmography sensors. We use PPG sensors for blood pressure estimation. So before going to discuss our proposed method, first we need to know about a PPG, photoplethysmography. The morphological structure of photoplethysmography is given here. Like we know in this segment, the maximum value is called systolic, and the diachrotic niche is called diastolic of blood pressure. And these two values are using in blood pressure. So basically, in PPG sensor we use optical technology, in which we use a light which penetrate with the skin. And PPG sensor, it basically measure the change in blood volume. So we all are I think familiar by this phenomena, that how PPG sensor work. And those BP devices which are working based on PPG sensors, they have some limitations, such as like motion artifact, poor signal quality, calibration drift, and even individual physiological variability like skin tone is also one of a limitation. And besides that, environmental factors also affect the PPG based sensors algorithms limitations, and like limited dynamic response. These all these are the limitation of PPG sensor. In our study, we try to overcome these limitations. In our proposed method, we use PPG sensors, a single PPG sensors, to estimate blood pressure. So we basically use a deep learning model, in which we use a CNN. CNN basically we use for a feature extraction, most of researcher they first calculate or extract the feature by themselves and then give it to their model. But in our study, our model will extract features, not us. Means we try to avoid the pre-processing steps to reduce the time complexity. So that's why we use a CNN which will extract feature by itself, and then these features will give to LSTM model, and LSTM model will predict two value of blood pressure, which is systolic and diastolic. So a CNN model which we use in our study is six layer model, and we use a single PPG sensor input and give it to our model, and ABP, arterial blood pressure, we take it as our reference value. This we already discussed. So in our experimental data set, we use basically two data set. One is which is available online, that is MEMIC data set, and the other one is our in-house data set, which is Hong Kong Center for Cerebral Cardiovascular Health Engineering, in short we called COACH. So we collected 50 subject of data in our in-house COACH data set, and we use 1000 subjects from a MEMIC data sets. Here is the experimental setup of our dataset. We use a single PPG sensor for PPG data extraction, and we use finger cuff for arterial blood pressure estimation, and use biopic system, and for visualization we use Acknowledge software. So here is the overall setup of our experimental setup. By using that, we collected our own in-house dataset. And here is the model of our proposed study, in which we use PPG as an input and ABP as an output. So first of all, we divided the data into segments, and we remove the bed segment just to reduce the time complexity, and then we divided our data into training and testing, and we the ratio of training and testing is 80 to 20. 80% of data we used for training, and 20% and then we use for testing to evaluate our model. 6-layer CNN model we use, which is used for feature extraction, and the output of CNN model we give to a by LSTM model, which is RNN, and here we predict the BP, two values of BP, which is systolic and diastolic. So on 80% of data we train our model, and then we use our rest of the 20% data we test our model performance. So the matrices which we use to evaluate the performance of our model, and these are like mean square error, means absolute error, RMSE, and standard deviation. Here is the statistical results of MEMIC dataset. According to golden standard, if your mean absolute error is less than 5, then model is considered performing well. And in our both dataset, for COACH and MEMIC dataset, we can see that our MEE is less than 5. The same is for other, like if mean error, if it's more close to the 0, it's considered like good model, a well-performed model. Here is the visualization of MEMIC dataset, and we can see a mean error histogram. As I mentioned, if the value is more close to 0, consider a good model. So in this case, we can see almost 90+% of our values, it falls near to 0. And here is the predicted and reference systolic blood pressure, and here is the graph of reference DBP and predicted DBP. Here is we can see a regression model. In regression model, here is a reference line. If the values are close to the reference lines, it's considered good, performance is good. So in our case, we can see most of our values it's on our reference line. So the same we show for our COACH data set. We can see the visualization of our data set, and then we compare our result with the golden standard, that is AAMI. According to these golden standards, if ME value is less than 5, less or equal to 5, and standard deviation value must be less or equal to 8. And we can see in our model that for MEMIC dataset and COACH dataset, our MEE value all are less are equal to 5 and standard deviation all of our value are less than 8, so our model fall in this category. So we compare our result with the golden standard of AMI, and then we compare our result with the BHS golden standard. According to this, they divided the data into like grade A, grade B, and grade C, and there are many ranges they gave. So here we can see our result all in both for coach and mimic data sets, it's fall in category A. So that's all for today presentation, is I have a time limit of 10 minutes. Anyone who want to ask a question, they can send me a message on my email address, and here is my WhatsApp number for quick response. And even if someone want to using WeChat, they can contact me on my WeChat. And beside that, if someone interested in a collaboration, then they can approach me. We will start some collaboration in future. Hope so. Thank you very much for listening. Okay, Allah Hafiz.